Hi, my name is Dr. Kameelah Phillips, and I'm a board-certified obstetrician and gynecologist, lactation consultant, and mother of three. Now, I've delivered thousands of babies, so one thing that I can admit is that the postpartum experience, also known as the fourth trimester, doesn't get the time and respect that it deserves during your routine postpartum care. So I'm here to share with you 3 tips that I hope will help you out during this really sensitive time. I get it. Between sleep deprivation, breastfeeding, the whole experience of a new baby, it can be overwhelming. But sit back. I hope these 3 tips help you navigate this really special time with information and grace so that you can get through it. So, the first tip is to recognize that breastfeeding is a journey and you need to handle yourself with grace. I have a few suggestions for people who are planning to breast or chest feed their newborn infant. One is to take a class. Now, we take a lot of classes before the baby comes, and breastfeeding might not seem so intuitive because you don't have a baby, but it is an important building block to your confidence around breastfeeding. In a breastfeeding class, you'll get information and anticipatory guidance of what it's like to feed a newborn. This is especially important in those early morning hours when you're questioning yourself as to whether you're doing everything right. A breastfeeding class can not only, again, give you information, but build your confidence that you are breastfeeding successfully. The second thing that I would say is it's your job to make sure that you see a lactation consultant before you leave the hospital. The lactation consultant can help you troubleshoot issues that might arise after your discharge in those immediate postpartum days where you're dealing with nipple pain or even engorgement. A lactation consultant can help you quickly strategize and resolve those issues so that you can continue your breastfeeding journey. The third thing that I would suggest is that you build your tribe around breastfeeding. This means having the number or contact of at least 2 lactation consultants that you can set up a FaceTime or Zoom call maybe a week after you've been discharged to make sure that things are running smoothly and that you're not hitting any bumps. This can also include a small breastfeeding group that's in your area. Again, you don't have to meet in person, but a Zoom call would be really helpful to get support and engagement from other mothers around this journey. Breastfeeding is a journey. Give yourself grace, but empower yourself with knowledge before you start so that you can make the most of it.